My name is Barb Hestron, and I am president of Options for Sexual Health. And when I was in my nursing training back in the 1960s, it was just a few years before the law changed, where they removed all references to contraception out of the criminal code. So when I did my nursing training and was learning about contraception, it was actually illegal for me to be learning that at that time. And also during my training, when I was doing my obstetrics and gynecology part of training, I looked after women who had had self-induced or illegal abortions, and some of those women were very, very ill, and some of them even died. So it had quite an impact on me at that time.
Hi, my name's Jill Doctoroff, and I'm on the board of Options for Sexual Health. In my other life, I'm the executive director of the Elizabeth Bagshaw Women's Clinic. It was about 10 years ago when I first came into contact with OPT. I was working with Planned Parenthood Ottawa, and it was such a relief to have this enormous organization offer support and resources to the smaller organizations across the country. And it's something that it still does. And then I moved to BC a few years later, and it was really neat to see everybody think of OPT as a provincial organization, whereas I saw its scope as national. And it was really neat to go to the provincial office and see how few people worked in what I thought was an enormous organization. It's a small but committed group of people who get a lot of work done.
I know people come to OPT for birth control, and my experience with OPT was different. It was when I wanted to conceive, and at that time I contacted Planned Parenthood, and I spoke to the woman on the line, and we went over my ovulation chart.
So why do I support OPT? I'm one of those people that's never had to depend on OPT before, and when I came to the board of directors, I realized quickly that all the sexual health rights and freedoms that I've sort of taken for granted in my life could be taken away at any time. And that is why now I am proud to work on the board of directors to make sure that sexual health rights are available for all of us.
It's kind of at a career crossroads. I was thinking about what I wanted to do with my career, and an opportunity to volunteer at Planned Parenthood came my way. So I took the volunteer training course, and after the first session of that course I was absolutely hooked. And since that time, which was 1974, I've worked as a volunteer. I was a staff person for then Planned Parenthood for 18 years. And then when I left working at Planned Parenthood, I was on the national board of Planned Parenthood, and then I was asked to come back, and now I've been a volunteer again as a board member.
Hi, my name is Jenny Redpath, and I work for Options for Sexual Health on Salt Spring Island. I've been working with OPT for about 1 year now. Through that time, I've worked with some amazingly committed registered nurses, doctors, and volunteers. I've also had the opportunity to meet with some exceptional clientele who have taught me so much about the diverse world of sexual health.
Even after following what she recommended, I still wasn't able to conceive. And after a lot of tears and a lot of stress, I gave them a call again. And on the phone, we were charting, and she says, "Oh, you've been missing the mark. You're actually ovulating right now." She asked me where my husband was, and I told him he's at work. And she says, "You need to call him because there's a window of opportunity." I gave him a call and told him, "We've been missing the mark. You need to come home now." And that was 13 years ago.
And I guess if you asked me what Options for Sexual Health means to me and what impact it's had on my life, I'd have to say it's pretty profound, that I've had tremendous experiences, worked with wonderful people, learned a lot, and had a really good opportunity to work in a field, namely sexual and reproductive health, about which I am absolutely passionate and probably will be until the day I have no more passion left.
I'm thrilled to be involved with OPT because it does amazing work. It looks at sexuality throughout the whole life cycle, and it does it in such a positive way. It's a pretty rare thing. You know, I remember when I was in school, we had one class on sex and sexuality, and the teacher was visibly uncomfortable, and she didn't encourage any questions. She really could have used the help of an OPT educator. And when my friends and I were ready to think about contraception, it would have been nice to have a clinic to go to. And my parents and I never really talked about sex or sexuality. They just didn't have the resources. They could have used something like OPS, How to Be an Askable Parent. What's not to love about it? It's an amazing organization.
I'm so fortunate to work with an organization that really celebrates healthy sexuality and promotes positive sexual self-image for individuals, and where I can help advocate for access to accurate information and also to education for our clients and for our communities. So I just want to say thank you for letting me be a part of that community.
I'd love to take a moment right now to give a big thank you to some of our huge supporters out here. People who move, not just have made this event fantastic, but are helping move our mission forward. Dan Savage for coming out here. He's the coolest dude alive and has given his time to come out and address us today. Jennifer Breakspear, a fantastic new executive director at Options for Sexual Health, who's really taking all our sexual health and advocacy work forward, and it's very exciting to see where this organization will go in future. And of course, the wonderful staff and volunteers who work at OPT. These are the frontline people who answer the phone when you call. They don't get weird when you ask all your crazy questions, and they're making our world a better place.